The conversation around mental health has really changed. And if we're looking over the past decade, this is historically, I think not just the past decade, but for all of time really has been a topic that has been full of stigma. People have not been talking about it. Yet today in 2020, if you're looking at the rates of mental health, depression, 1 in 5 adults in the United States suffer from some type of mental illness. 1 in 6 children are suffering. I think the statistics are at an all-time high, which is the downside, but things are really starting to shift in terms of people's comfort around being more open about the conversation, having the conversation.
Right.
To what do you attribute that change, and what have you been seeing?
I think we've just reached a fever pitch. People feel bad now and they don't know why, and then you can't deny all the numbers. And in fact, people always say the 1 in 5 people study for mental illness. There's so much mystery around mental health. It's actually 5 out of 5 because a lot of people conflate mental health with mental illness. And if you look at it, there isn't anybody who hasn't been at least indirectly affected by anxiety or depression or burnout. And so I think that it's an interesting time where it's kind of undeniable that we have to do something about it. Even if you look at corporate influence on it, it used to be in the 80s and 90s, your insurance would cover up to 20 talk therapy sessions a year. But people weren't using them because they didn't want their boss seeing that they were going to see a therapist, which would be grounds for dismissal. You used to be able to fire someone if they had this kind of disability. And so, but now you see big companies sponsoring big mental health initiatives. And actually we did some work with MetLife this summer. Their number 2 disability claim used to be musculoskeletal. And last year, for the first time ever, it was mental health related disability claims. And so it's just gotten to a point where it's undeniable that this is affecting not just your workforce, but it's affecting the bottom line.
And thinking about all of the nonprofit organizations and think tanks who have also been working on this for decades, we're starting to see interesting partnerships come about where you have celebrity voices opening up with their stories, nonprofit organizations stepping in with research and data and resources, and then you have startups who are stepping in with therapeutic services. These are new kinds of partnerships that have been forming in this space too, which I think is fascinating because you didn't really see that 5 years ago, let alone 50 years ago.
And I think that's because before, 5 years ago, 10 years ago, 20 years ago especially, people would be like, that's a personal problem. But we know now that it's a social problem. All of these mass shootings are going up. Adolescent suicides are going up. Even elderly suicides are going up. There is no mental health without social health. And I feel very strongly about that. That's, I think, extremely important that nonprofits and corporations are stepping up to fill that gap.
And work together.
And yeah, it's been great. Shout out to Kenneth Cole Foundation. They're doing the Mental Health Coalition launching. We're going to see a lot of great initiatives coming up this May, which is Mental Health Awareness Month. I know we've got a lot of fun things planned. But yeah, it's just great to see this is a problem. And as we know with the economics of healthcare, people aren't always necessarily incentivized to care about this issue, but it affects literally everybody. So I'm glad to let's just put all hands on deck.